Hello and good morning, and welcome to yet another digital exclusive right here on CNN News 18. Today, we're talking about something that had a lot of people worried, especially parents of young children, which is when will we have a vaccine for kids? Now, Covaxin, which is Bharat Biotech's vaccine, has gotten a nod as far as Covaxin for kids is concerned. It will now go up to the DCGI, and then we'll talk about the timeline of the rollout, so on and so forth. But to discuss one, how big a boost this is for India's vaccination drive, and two, how much relief is it bringing to parents? I have very special guests joining me on this broadcast. We have Dr. Bagai, who's the chairman of Nephron Clinic, to talk to us about how much progress India has made in terms of its vaccination drive and how soon can we actually see a rollout. I also have with me Sharath, who's a parent of young 8-year-old child, for us to help understand how big a relief is this, because we've been talking about that inevitable third wave, how our children are not vaccinated, schools want to reopen. So does this now bring a sense of relief and reassurance to parents and teachers alike? But Dr. Bagai, I want to first begin with you. How big do you think this is a step and a boost as far as India's vaccination drive is concerned? Because as far as some of the global countries, we have seen some vaccine for children. India so far hadn't made progress in that. But with Covaxin now getting the first nod, then going up, of course, to the DCGI, how will this help India's vaccination drive?
Good morning. Thank you for having me. So I'll break it up very quickly into three major parts. One is it's important to understand the demographic distribution of the pediatric population in a country like India. Now we have a 0 to 18 age group of approximately 45% of 139 crores, which is approximately 50 crores. So this is the largest segment of the subpopulation of India, which so far has remained completely unvaccinated. So at this critical juncture, when we have almost reached 97 crores as we speak right now in the total vaccinations done pan-India, and knowing that we have to do about 180 to 190 crores, so we are about 65-70% of the journey through. This is going to give a huge momentum to a chunk of population as the pediatric population. Why is the pediatric population extremely important and vulnerable? The reason is that children carry the same viral load as adults. They get lesser and milder infection, but in the last few months, worldwide data has shown that the incidence almost has doubled. There are certain countries and certain states and counties in US and in Western countries in which the incidence has increased 1,000 times more during this Delta wave. They are undergoing this third and the fourth surge, and likewise in our second surge. The children also in the Delta carry in the first 2 days of infection 1,260 times more viral load as compared to the Alpha and the Gamma strain. Therefore, they are potential carriers of this infection. We also know children can transmit this infection from 40 to 60%, mainly indoor transmission, and they can be carriers to transmit it to the parents and grandparents. Children, by and large, can have mild, but the asymptomatic mild infections can, after 6 months to 12 months, have what we call as long COVID multi-organ involvement, which involves the brain, the heart, the lungs. And it's unfair to leave this vulnerable population unvaccinated. So this is going to give a huge boost, a very important step, and I would call this as a threshold, as a landmark, which is going to push us towards complete herd immunity.
Absolutely. Sharath, I want to understand from a parent perspective, this is what had most parents worried. When schools started to reopen, most parents said, but my child is unvaccinated. I don't want to take that risk of sending my child out, and then he becomes the carrier, not just for the parents, but for elders or senior citizens in the family as well. With Covaxin now getting this nod, how relieved do you feel? And would you want to go ahead and ensure that your child is vaccinated?
Definitely. In fact, I'm much more relieved. And when the news broke in, I was more than happy. And even my immediate family members, I mean, they're also looking forward to when we can book a next slot for our kids to get vaccinated. Because vaccination is the way forward for out of this pandemic, right? And schools need to reopen. And for schools to reopen, the kids have to be vaccinated. And it's important that we, as citizens, repose faith in our institutions, medical fraternity, scientists, and go ahead with the vaccination. So I'm quite bullish and quite hopeful that this will actually help us come back to normal, and even kids will go back to the schools and relive their childhood.
Yeah, absolutely. I mean, children really have been, the worst impacted with this pandemic. They've been locked inside the houses for almost a year and a half, haven't met their teachers, their friends, have had no human interaction. So this becomes that one, element to try and get them back to normalcy. Dr. Bagai, now I want to take in some FAQs, a lot of questions people have written to us because there's still a lot of gray area. One, because Covaxin hasn't gotten a WHO approval. So then how much should we read into this note that is coming yesterday?
Okay, so there are two very critical points. I think the entire approach of world regulatory authorities has been found wanting. The vaccine of Covaxin in the phase 3 trial, which was actually published in public domain in June, July this year, has shown overall efficacy of 77.8%. That's fantastic. Even against the Delta strain, 65%, and symptomatic versus asymptomatic as much as 68 and 93%. This is extremely good. But more important than that is the real world data. We have given almost 11 to 12 crore vaccines out of the total 97, which are Covaxin. It has shown a very low breakthrough infection rate of just 0.2%, extremely mild reactions at the local site of 0.005%. And the proof of the pudding is in the eating, in which we have saved millions of lives because of these vaccines. This vaccine, especially Covaxin, is a whole viron vaccine, inactivated. It causes no serious side effects, even though the rare side effects of the mRNA vaccines of pericarditis, myocarditis, thromboembolic phenomena, which is blood clots, anaphylaxis, local reactions, allergies, is not there because the platform is different and it's a very robust platform. I think children need protection. 1 to 2% of these children ultimately land up with multi-organ involvement, and it's unfair to subject the long children to even mild or asymptomatic infections. So this vaccine is good, it is safe, it is highly immunogenic. That means it gives a very good response, and children have a very naive immune system, which we call as it can modulate and be malleable towards towards the vaccine, and gives a very robust B cell and T cell response. So I have no reason to doubt that this vaccine will protect a very large segment of children. Also, children have comorbidities. This is something which we normally do not discuss and don't talk about, because we normally think that comorbidities happen in the older age groups or the geriatric age group. But children have an ongoing element of obesity, hypertension, diabetes, chronic organ involvement such as chronic liver disease, kidney disease. A significant segment of pediatric population of blood cancers, of solid organ tumors. These are what we call as extremely clinical vulnerable. And the incidence as far as the risk factor, what we call as RR, risk ratio, is 10 to 11 fold more than other populations. So these children with comorbidities need to be protected first. I presume that it will be 12 to 18 as an age group, and then further categorized as the extremely clinical vulnerable and the ones with comorbidities, then going down to 5 to 11, and then below 5.
Okay. That clears a lot of doubts, Dr. Bagai. Sharat, I want to come to you. As I said, that children had been the worst impacted. They had been kept inside the houses, not being allowed to go play out with friends, not go to schools. Then we had a lot of experts talking about this inevitable third wave, which a lot of experts said would actually impact our children the worst. At this time, what were your biggest concerns as a parent?
So, as a parent, we were concerned about how soon the vaccine can come out, right? And since there's a lot of, I would say, negative discourse going around about how this might impact children, and there's vaccine hesitancy, right? So that was, I would say, the biggest concern, whether the people would or parents would come forward with the children and get vaccinated or not. But as of now, since we have the phase 2 and phase 3 trials data, and since the subject expert committee has approved, right? So I think this is the right move, and all parents should come forward. I would urge everyone to go ahead and get their kids vaccinated whenever it's available.
Okay, Dr. Bagai, the other big question now that's coming in from parents and even teachers and everybody else is, when will we see the rollout? Now we know this is only the first nod that has come. It'll now go up to the DCGI, and of course we are waiting at the same time for WHO approval as well. Realistically and idealistically speaking, what is the kind of timeline that you're looking at? When can we actually see the vaccine in the market for kids to go ahead and get themselves prepped?
Yeah, so there are 2 points in this. One is a lot of people have based their wrong opinions that this has not been reviewed. I think the Indian scientists and ICMR and the Vaccine Expert Committee are perhaps one amongst the best intellect minds the world can actually gather together. So I want everyone to have faith in our Indian scientists. We have delivered in the past and will deliver even now. Point number two is, having said that the DGCI is going to review it, there are various processes which are looked into. The kind of endpoints which we look at is protection for symptomatic, protection for asymptomatic, age group wise, male versus female, the immunogenicity in terms of IgG, IgM responses, T cell responses, breakthrough infections, local reactions. So there are various kind of endpoints which we look at. I envisage approximately 3 to 4 weeks from today, the initial rollout will start. This is going to be a huge momentum. And the reason I'm continuing to say this is that every 20% increase in the vaccination of a particular community decreases the risk of community host-to-host transmission 7 times lesser. That means you are breaking the chain of transmission from a child to a child and a child to an adult.
Absolutely. And I want to say this to our viewers. We all saw what happened during the second wave. Almost everybody knew somebody who either was in the hospital or, couldn't get an oxygen cylinder, couldn't get in a hospital bed. Yes, a lot was said about the state government, but a lot was said about our own responsibility as well. Now, when you have a vaccine, which is the only option currently available, if you're eligible, please go ahead and take that vaccine jab, because as Dr. Bagai was saying, this really, everyone taking that vaccine shot will help us inch closer towards that common goal. And now there's a festive season coming up. There is an understanding and an assumption that we will see our guard come down. But this is not the time to be irresponsible, because if we don't want the third wave to hit us stronger, we have to be responsible. Dr. Bagai, I feel you want to come in?
Yeah, just a quick point which I want to make. I think our decisions worldwide are made on hard data and science which are analyzed. The largest segment which has been analyzed by CDC in US is of 25 lakh children. That's 2.5 million children. And 15% of all COVID admissions in the month of August and September were pediatric age group. And 23% of them required ICU care. So that's a significant change of dimension of the clinical presentation of children. So I don't want people to feel that children get mild infections or asymptomatic infections and therefore they don't need vaccines.
Correct.
Children can get long COVID of almost 15 to 20%. And these are the children who can manifest months later with severe organ damage. So please get your children vaccinated. I know parents take their children's vaccines extremely seriously with great responsibility. And having been in this vaccine industry now for almost 37, 38 years, I know that this is going to be one of the most successful rollouts in the pediatric age group.
Absolutely. And a lot of parents had written to us also asking what type of vaccine this is. So this is a syringe vaccine, and you'll have to take it within a gap of 28 days. So there will be 2 doses. Sharad, I want to understand, did you have a chat with your 8-year-old? Because usually syringes are something that scare a lot of children. Did you have a chat with your child? Did you tell them that there is a vaccine now for children? And very soon, all these checks and balances that parents and elders have put in the child could possibly be taken away, and the children could return to their normal lives.
Yeah, in fact, I told my daughter that it won't hurt you much, because she has seen us as a family getting vaccines, right? So, and in fact, kids are more excited to go back to school. Teachers are back at school, and they are conducting online classes from schools, right? So even kids are more excited when they will be going back. But again, the prick and pain might deter the children a bit. But again, everyone is quite excited to come back.
Perfect. Okay, Dr. Bagai, I am running out of time. I'll give you the final word. A lot of parents wrote into us asking about the efficacy of the vaccine vis-a-vis some of the vaccines globally which are being used for children.
Yeah, so very quickly, I want to reassure everyone that the latest information, which was on air last evening, is that the pediatric vaccine efficacy is matching the adult vaccine efficacy of Covaxin, which is 77.8% as overall vaccine efficacy. The platform which is used is a very robust platform. It does not only target the receptor binding domain genomically, but also the N-terminal domain, because it's a whole viron vaccine. It's an extremely robust platform. This gives long-term memory response, in which children will get long-term protection. These children, whoever get these, are getting very mild local, maybe a little bit of pain and little redness for a couple of hours. There is no significant side effects. I don't want people to feel a local reaction is equal to a side effect. It's not a side effect. It's safe. It is immunogenic. It is giving you great amount of protection. Children will break the chain of transmission. They are the largest subpopulation segment in our country. And I wish that this program begins ASAP, and all the pediatricians, I'm sure, will be giving a helping hand to push this drive towards success.
Okay. Okay, that's a word of reassurance there coming in from Dr. Bagai. Before I wrap the discussion, one more question that was asked by most parents was, can we travel abroad with our children now if we've taken Covaxin? So the answer to that is currently no, because you still have to wait for a WHO approval, but all signs are in the making for that approval to come as well. I'd like to thank Dr. Bagai as well as Sharath. We hope we could answer most of your questions. And we say this every day, and we're saying this again: have faith in your scientists, have faith in your experts. If you're eligible, go ahead and take that vaccine jab. We'll leave this conversation here. You write into us and tell us what you thought about it. Thanks for watching.
Thank you.
Thanks, Ridhima.